So we're done with the GOP healthcare bill. Now here's the deal. This is a disaster. I won't tell you anything else. This is a disaster. It's not good. It doesn't look good for Republicans. It certainly doesn't look good for having a functional government on any level. Now, the left is taking this opportunity as it deals with healthcare to try and push their solution, which of course is a single-payer plan, a universal healthcare plan. The Young Turks, enter Young Turks. They always transitioning there.
They always do that.
They released a video today with the title. Now this is important because it's the title of the video. #clickbait. It says, universal healthcare has been working great in Germany for a long caps time. But let's get to what they say.
The story of universal healthcare begins in Prussia in the late 19th century with, I think we have an image of him. This is Otto von Bismarck, and he not only proposed the first modern welfare state, but also in 1883 proposed the sickness insurance law, which is the precursor to modern universal healthcare. And it's actually known as the Bismarck plan in many European countries.
Talk about quality control. Did nobody just go, iron your shirt? He looks like a Tony Hawk had sex with a retarded Tony Hawk. Okay. So he's talking about the first.
We got the ad hominem out of the way.
Yeah, out of the way.
Substance
Why is
only.
it ad hominem? But it's not
And
only
now.
ad hominem, but ad hominem in addendum to substance can be a lot of fun. So the Bismarck, he talks about the first welfare state. It's a scam. Like the welfare state is almost invariably a scam. It is a Ponzi scheme. Remember Rick Perry got so much flack for saying Social Security was a Ponzi scheme. In Bismarck, okay, the retirement age for their welfare security net was set at 70. Average life expectancy at that time was 42.
Some would say that's brilliant.
And what's funny is it actually mirrors a lot of United States Social Security. I think it was set, the average life expectancy was 68. It was set at 65, and there were either 3 workers per retiree or 3 retirees per worker, but now it's something like 16 retirees per worker. So invariably you have to add more people paying in, or you simply have to change the math for it to work. That is the definition of a Ponzi scheme according to the SEC. The only reason it's not considered a Ponzi scheme is because these are the same people who write the rules from the SEC, so not when we do it. And I think in Bismarck, about 10% of people, there's your universal healthcare coverage. 10% of people were covered. So it wasn't necessarily successful. But let's get to more of their arguments as to why it's been working in Germany specifically for a long time.
I've heard this. I don't have any evidence to this, but I've heard from my physician friends that around 1900 was around the point where if you went to see a doctor, you had a better chance of the doctor healing you than making you worse.
What happened around 1900? Got the entirety human of history. For some reason at 1900 is nothing, 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 nothing. Boom! Vaccines and x-rays. It was a second industrial revolution, dumbass. Again, this was free enterprise and capitalism and technology benefiting mankind through the modern marvels of medicine. Something which, of course, is stifled under a socialized system if you actually look at medical research was being conducted. Okay, so the Young Turks, here's a problem. I wish we had more clips. There's nothing in there about Germany.
They pivot completely.
Pivot completely. When you title a video, it's been working in Germany for a long time. I think clickbait is I expect a video about universal healthcare in Germany, and then there isn't one.
There isn't.
So let's address the arguments, because a lot of people will just see the clickbait title and say, hey, it's been working in Germany. We've had this. We've had people on the show, liberals, come up with titles, and we're going, well, hold on a second. How do you substantiate that? Well, we just so happen to have Cenk Computer, our intern from Germany. So, and the reason this is important is because they've pivoted. It used to be Canada all the time, and now they're going to Germany. Kind of like when Bernie Sanders talked about Venezuela, used examples for socialism, and then he said, it's not really Denmark. The Danish prime minister said, we're not socialist anymore. Stop calling us socialist. And they go, Sweden. And there's rape, and they go back to Germany. Like, shoot, we were just here. So these are things that you don't know about Germany. Everyone in Germany has to pay 14.6% of their salary for healthcare through the state. And you can only opt out if you make over 4,800 euros per month. Think about that for a second. If you're making 50, 60,000 euros a year, that could be over 7,500 euros at the end of the year, which, by the way, if you look at American plans, privatized plans for an individual, a young, healthy, that would be way higher than most people would pay.
Yes.
But let's assume you're fine because you don't want personal responsibility. Choice intimidates you, so you just want the government to take care of it. What do the numbers look like? All right, not KJ, let's bring up this next number here. Germany has the 4th highest health expenses in the world, and the compulsory individual fees, be they state or private, carry on at a rate rising faster than inflation. Now, I know that you'll say, well, we have some of the biggest healthcare costs in the world, and I'm not going to argue that. The United States, the current system is not working. That's because we have an ungodly marriage between government and private insurance and lobbyist groups and special interest groups and kind of bordering on going to a public option, but we didn't really get it. And so costs have skyrocketed. Just like when you look at the industry for student loans. This is a cottage industry that involves an overly intrusive government. It doesn't work right now. Our costs are high. I'll be the first to acknowledge that. But the solution is not to go to a system that yields lower quality, worse results, lower survival rates at increased costs. Certainly if you apply it to the United States when it has, 10 times the population, 20 times the population of some of these countries. Life expectancy, how do you substantiate that? How is it higher quality of care? Life expectancy rates are much higher with mortal diseases here in the United States. As a matter of fact, depending on the cancer, it can be up to twice as much in the United States than in Germany. And here's something else. Even if none of these numbers, we have more of these numbers, we'll have them available, you can look at the resources. Even if none of these numbers were true, it still doesn't take into account that Germany, Sweden, Denmark, they don't have to foot the bill for the security of the entire free industrialized world to begin with. When I lived in Canada and they were going, the United States doesn't have this, we can do this socially, we can do this welfare. I'm going, yeah, but that's because the only reason that you aren't being conquered by anyone who feels like it at that given moment in time is because of the United States. Love Canada, but you have a crappy healthcare system that's subsidized by tax dollars because it doesn't go to creating a military. Let's break this down. So the solution here from the left was to force everyone to buy private health insurance. Okay. Now force insurance companies to accept everyone. Now, again, this is where the filter through which you see the world matters, because if you go, well, hold on a second, there are all these people who are uninsured, and you just go, that's mean. Well, why were they uninsured? There was a significant amount of people who were young who didn't want to be insured. Yep. There was a significant amount of people who had serious pre-existing conditions who never purchased insurance until they had some kind of catastrophe hit them. So it's not just people couldn't afford health care. It wasn't just the generic middle-class American worker couldn't afford a basic health. That's just not reality. But if you look through the lens of entitlement, that's how you would see it. So let's force everyone to buy insurance. Okay, put all those people in there. Now force insurance companies to accept everyone, now including the highest risk, highest cost applicants in their risk pool. Now the solution, because costs are out of control, this is what you see. They actually talk about this in the video, and I had people talking to me about this on Twitter. Before we go to a universal healthcare plan, a public option, we need to force insurance companies to set price maximums. In other words, we need to enforce rules now that insurance companies can't charge more to stay afloat, which they need now when they're bringing in all kinds of people who live on a diet of soda and fried Snickers and come in because they didn't get insurance until all of a sudden they had to have 2 legs removed because of their diabetes, and they watched a Wilford Brimley commercial and said, I think I have that. So now I want to tell the insurance companies that person walks in your door, millions of them, and you can't charge them more. Well, listen.
That's a textbook's definition of capitalism.
Do you even economics, bro? And what's going to happen? Insurance companies won't be able to say, and so they'll close their doors, which of course is what the left wants. They want to see all insurance companies close their doors. They want a public option, and they want the public option to be the only option, and that brings us to a single payer system. This is the solution that they have, and this is why when you look at this is where the Republicans cannot concede ground, because this is the ultimate goal of the left. You see it with the first drafting of the American Health Care Bill, of the Affordable Care Act from Barack Obama. You see it with the public option. You see it with their statements regarding the public option, that the public option, we can just continually flood it with federal tax dollars and no private insurance company can compete until it's the only option. It becomes single-payer health care. That has always been their goal, so we cannot go any further along the trail. They want insurance companies to close the door so that that's what they can have. But I'm sure that the Mr. Producer from the Young Turks was going to get to that.
Many urban U.S. workers gained access to what's called sickness insurance. Yeah, they got the wrong image there, but we'll get to it. The IRS, but tax changes. But the question, what's interesting to me is that nobody seems to know why employer-based healthcare plans. I don't even know what that is, but the workers whatever they want.
Okay, okay.
But the problem is, Dinesh D'Souza can't. But he pulled the Social Security or the healthcare elements, so they were able to do that. And
in Syria. I'm sorry.
I don't even know what that is, but universal health care.
See, this is why old TV, they say the internet hasn't arrived, it's just low quality. Don't lump us in with that guy. That guy is a dinosaur in new media, and he still hasn't learned to read prompter. But, I mean, he still hasn't learned to use a hairbrush. Hey, if you like this video, subscribe by clicking the button that says subscribe. If you're not aware of it now, there's no way you're learning the internet at this point. I'm not going to help you. But this was clipped from my daily show, available exclusively to louderwithcrowder.com/mugclub members. If you're a student, military, or veteran, enter in that promo code. It's less than $6 a month, and you get daily content. No more clips, plus this hand-etched mug. Oh, when I feel it, I got a chill like on the inside.